basically I'm a chronic pain doctor, and almost every single person that comes to the office doesn't have the diagnosis of joint instability, and that's actually what's causing their chronic pain. Most people don't realize that it's very difficult to diagnose joint instability with an X-ray or an MRI. Now they do have motion MRIs, motion CT scans, motion X-rays, and sometimes they pick it up. The reason why they don't pick up the extra motion is because we have muscle guarding. In other words, you actually have instability of the lower back, like you have vertebral instability in your lower back, and we put you in different maneuvers, but it doesn't show the extra motion because your muscles are guarding. The muscles are causing the vertebrae not to move excessively during the exam. That's just called a false negative. Like, in other words, you get a negative flexion extension X-ray, but it doesn't show up the problem that you really have. So it really is a clinical diagnosis. And often what I'll do is I'll take people's thumbs and I'll go like this, and it'll go click, 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 click. And I'm like, my thumb doesn't do that. So I just show them that they got even instability of their thumb, even though they may not have pain in their thumb yet. And when you have excessive motion of a joint, like it's going click, 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 that's called mechanical instability. You have a structural weakness, that the bones move too much, that the bones are hitting, and that's what you feel, or that's what you can hear. We call it, when you get symptoms, so in other words, a pitcher can't pitch and it hurts them when they pitch, that's called functional instability. Functional instability means that you cannot do this function. Or a person has knee pain when they walk. They don't have knee pain when they sit still, but when they walk, the ligaments are loose, so the bones move too much, then that causes muscle pain, joint swelling. That's called functional instability. So normally, me as a prolotherapist, I often won't see the patient till they have symptoms and they have functional instability. But no, they often have mechanical instability in many different parts. So anyone who's manipulating the joints, like they're manipulating the spine themselves, or they've gotten a lot of chiropractic manipulation, they're going to have mechanical or functional instability causing their pain. So when you have joint instability, it puts a lot of extra pressure, 2 times the pressure, 3 times the pressure, 5 times the pressure on the joint itself. And that extra pressure is going to cause a lot of force to be concentrated in just one area. So in other words, if you have a ligament injury on this side of the knee, the medial side of the knee, then when you walk, instead of the pressure going all across the knee, it's going to get concentrated just on the medial side of your knee. When there's too much force per unit area on a structure, whether the structure is the cartilage, ligaments, tendons, you're going to get pain. So one definition of pain is it's too much force on a particular area. And normally that's not because of working out too much, it's because you got joint instability, right? You know, I work out a lot. I'm a 5-time Ironman. I don't have pain in my knee. So why can I run 10 miles and the other guy can only run 2 feet and their medial side of their knee hurts? It's not because of a muscle injury. You know, you exercise and it feels worse. It doesn't feel better. It's not because your muscles are too tight. You get a massage for 2 hours, your muscles are loose, then the pain comes back. So it's not from that. It's because there's too much force on the area because you got instability. Now, the way the body diffuses the force, like on the knee, it swells the knee. If there's swelling in the knee, then what's going to happen when you walk? The force is diffused. So swelling is nature's way to protect the knee. Why? Because you have joint instability. So the treatment shouldn't be to get a corticosteroid shot to eliminate the swelling or to take an anti-inflammatory, because what? You're eliminating nature's protective mechanism to protect your knee because you have joint instability. So the treatment should be to tighten the ligaments like on the medial side of the knee. Then the knee's not going to have a reason to swell. then the pressure when you walk or you run, it's distributed equally on the cartilage, then you're fine. Now, when you have a ligament injury in the back, mostly it's the capsular ligaments that connect the facet joints. So when you have a capsular ligament injury, that joint does swell. That's why sometimes they do steroid shots into the facet joints to reduce the swelling. But as I said, that's a terrible treatment because the swelling is protecting the facet joint, it's diffusing the pressure. But in the spine, when you have a capsular ligament injury, the body will also protect that area by muscle spasms. You'll get muscle guarding. So the treatment isn't to get chronic massages or chronic manipulation. The treatment should be to stimulate the repair of the ligaments. The treatment to stimulate the repair of any ligament is called prolotherapy. When you have a cabinet and the hinge is loose, you have to take out a Phillips screwdriver and you have to screw in the screw. That's the only treatment, is you got to screw in the screw. So when you have a loose ligament causing joint instability, and the joint instability causing too much pressure on a structure, so the body, to get the pressure off of the structure, will swell the joint, you'll get spasm in the muscles, then the treatment should be to stimulate the repair of the ligaments by prolotherapy. Then you get stabilization of that joint. In the vertebral area, they call that a motion segment. So the two adjoining vertebrae, they become stable. That way, when you move, the vertebrae stay together. Then that's going to eliminate the muscle spasm, eliminate the joint swelling, and the pain goes away. So almost all the tendon problems, tendinitis, tendinosis, elbow tendinosis, Achilles tendinosis, jumper's knee, patellar tendinosis, rotator cuff tears, rotator cuff injuries, the reason why the tendons tear, the reason why the tendons become inflamed, the reason why the tendons degenerate is because there's too much pressure on those tendons because the underlying joint is unstable. You know the underlying joint's unstable, just go like this. Anyone who's got a rotator cuff problem, go like this and you'll hear click, click, grind, grind, crack, crack. So if you get a rotator cuff repair or you get a steroid shot, I got news for you, it's still going to go click, click, grind, grind, crack, crack. So it's just going to come back. The problem's just going to come back. The best treatment is prolotherapy, and the good thing about prolotherapy is it repairs it. It repairs the rotator cuff, repairs the ligaments, repairs the labrum. So prolotherapy is the only treatment that can repair all the structures that are injured. So it has a very high cure rate. So if an athlete or a person wants to get cured of their pain, they want pain cure instead of pain management, then they have to consider that the underlying cause of their problem is joint instability, and the treatment of choice is prolotherapy.